Did you know that most men worry about size at least once in their life? But science says almost all of them are completely normal? Today, we're going to look at what urologists really mean when they say normal size, how to understand your body better, and why confidence matters far more than centimeters. Before we start, for more honest and science-based health videos, make sure to subscribe to our channel. Dr. Kayla, Health Tips. Intro, why this topic matters. Let's be real. Size anxiety is one of the most common reasons men Google late at night. But here's the truth. Medical research doesn't treat this topic the way the internet does. Urologists look at it as just another body measurement, like height or shoe size, with a wide, healthy range. So today we'll cover 3 things. 1. What studies actually show about the average size range? 2. How to understand those numbers in a realistic way. 3. How to take care of your health and confidence instead of chasing myths online. Section 1. What normal really means. The word normal in medicine doesn't mean one number. It means a range that covers most healthy men. Think about height. Some men are 5'6", others 6'2", yet both are completely normal. The same principle applies here. Studies from major universities show that there's a broad distribution, and most men fall comfortably in the middle. In fact, research shows that about 90% of men are within just a small range of each other. That means if you think you're below average, odds are you're still within the medically normal range. Section 2. Why there's so much variation. Your genetics play a role, of course, but so do hormones during puberty, body composition, and even how researchers measure in studies. No 2 men are identical, and doctors never judge health purely by size. There's also a big mental component. Social media and unrealistic videos online have completely distorted expectations. Urologists constantly remind patients that confidence, communication, and physical health matter far more for satisfaction, both for you and your partner. Section 3. When urologists perform research, they use standardized tools and consistent methods, not at home, not with a tape, but in controlled clinical environments. The point is not to compare men. It's to understand anatomy and ensure there are no medical concerns, like hormonal imbalances or developmental conditions. If you ever have questions about growth or changes, a urologist can assess things safely and professionally. That's the correct way to measure, medically, not mentally. Section 4. Let's bust a few myths that harm men's confidence. Myth number 1. Bigger always means better. Reality. Studies show that satisfaction depends on emotional connection, foreplay, and communication, not measurements. Myth number 2. You can permanently change size with exercises or pills. A reality. There's no scientifically proven home exercise or supplement that safely increases length or girth. Most of those ads are scams that prey on insecurity. Myth number 3. You should compare yourself to what you see online. Reality. Those videos are often staged, edited, or use extreme examples. Real life and real relationships are very different. When you stop comparing and start focusing on overall health, your confidence, fitness, sleep, and stress, everything else improves natural. Section 5. Factors that affect appearance. Sometimes men think something's wrong when it's actually optical illusion. Body weight, posture, and temperature can all affect how things look. Doctors note that losing a bit of belly fat can often make a big visual difference, even though nothing changed physically. That's why urologists focus on lifestyle, not numbers. Healthy blood flow, balanced hormones, and reduced stress are far more important markers of men's health than size alone. Section 6. The psychological side. One of the biggest problems men face is comparison anxiety. They see unrealistic content and start believing they're abnormal. But here's what clinical psychology research shows. When men learn the actual data, that most are within the same healthy range, anxiety drops dramatically. Confidence, fitness, and communication skills are what partners notice most. So your self-image is a health issue too. It affects your hormones, your sleep, and even your motivation. Taking care of your body and mind together is the best size boost you'll ever get. Instead of chasing internet miracle methods, focus on what urologists actually recommend. Exercise regularly. Better blood flow means better performance. Eat heart-healthy foods. The same diet that protects your heart protects your sexual organs. Sleep 7-8 hours. Testosterone and recovery peak during deep sleep. Limit alcohol and smoking. Both directly reduce blood circulation. Manage stress. High cortisol levels lower testosterone and drive anxiety. These are not quick fixes. They're real, science-backed steps that improve how your body functions and how you feel about yourself. Section 8, when to see a doctor. If you ever notice sudden changes, pain, curvature, or difficulty with erections, don't self-diagnose. A licensed urologist can help identify whether it's hormonal, vascular, or just stress-related. There's no shame in asking. Urologists deal with these questions every single day. The earlier you talk about it, the easier it is to treat. And remember, most concerns turn out to be normal variations, not medical problems. Section 9, healthy mindset, confidence over comparison. Let's end with a mindset shift. Your body is unique, and uniqueness is not a flaw. Real confidence comes from knowledge, self-care, and communication, not from trying to match someone else's body. So next time you start comparing, remind yourself, science says you're probably completely normal. Your worth isn't defined by a number. It's defined by how you treat yourself and the people you love. Otro. If today's video helped clear up some myths or gave you a more confident perspective, hit that like button and share it with a friend who might need to hear this. And don't forget, for more, Trusted Men's Health. Stay healthy, stay confident, and I'll see you in the next video.